Belize, a small, beautiful gem of a nation. Lush vegetation, charming villages, a nation of hard-working people with strong religious convictions, a nation of modern cities and fascinating history. And a nation that is faced with a serious health problem. A problem that not only affects the lives of thousands of its people, but also attacks the country's social fabric and even its economic well-being. That problem is mental illness and depression.
Being a colony, British colony, where most people had to work in the field, they had little time for dealing with mental cases. And so from the very beginning, it was a practice to put these people in an institution. And so it became part of our culture not to deal with mental cases. As soon as we believed that a person was mentally ill, then that person should be put into an institution. And that is the practice up to today.
Well, in Belize, I guess like other countries, because the clinic, especially the psychiatric clinic, we tend to see a lot of patients that may have psychotic symptoms. So we do have patients that have schizophrenia. We have patients that have schizophreniform disorder, delusional disorders. We have patients that have manic depressive illnesses. And we also have people with depression, major depression, with anxiety, with phobia. Those are the common things that we're seeing in Belize. We're seeing now an increase in suicide attempts, and that and those people do have depression. We're seeing also an increase in children who come to the clinic for attention deficit disorder. So those disorders are common in Belize. I think in Belize, there's a high rate of unemployment, and that's an issue. There is also, poverty is an issue in Belize. So people more and more, the lifestyle has been changing. People a lot of times were used to being close to their families, and because of sometimes a lot of families, they have to migrate, they have to go to the States. So there is a lot of single families, single mothers. There's a lot of crimes, a lot of violence that is being happening, the teenage pregnancy. So all of these have been stressors that are affecting individuals nowadays, and then you find them developing easier, then become vulnerable to develop a psychiatric disorder.
Depression is very common, especially amongst female, because of their environment, the abuse, and the socio-economic. So female are more prone to depression in Belize than male.
Mental illness and depression are medical problems that affect the people of every nation in the world. Past treatment of these disorders has been affected by everything from budget restrictions to cultural myths, from lack of local treatment facilities and medical personnel to personal shame. In trying to change the way mental illness is handled in Belize, the Ministry of Health and Dr. Cayetano were up against formidable forces.
We realized that if we don't deal properly with the prevention of mental cases, the management of acute episodes, and to try to rehabilitate the chronic cases, what this end up doing to the society is to have an increased crime rate, to have many homeless, some of which we calculate in Belize to be 30% of our homeless are mental cases, or people just walking in the streets.
The challenge of treating depression, I find in Belize, it's quite big, and the fact is because depression is not necessarily acknowledged or recognized as a clinical disorder. So because it's not recognized as a clinical disorder, what we find is that people themselves may think that something is wrong with them, that they are lazy or they are weak, or and that they are not dealing with their problems appropriately. And then they go from here to here looking for answers and not knowing that what they're having is a clinical depression, which is a treatable illness if it's diagnosed properly.
And then I began crying and self-pitying myself because, hey, I don't know nobody and I don't want nobody to think I'm crazy, because of the trauma.
When people first step into the clinic, first of all, most of them deny that they are having a problem as a psychiatric problem. It's when you start your interview and your assessment, then you know that they do have a mental problem. And it is hard for them to accept, but with the counseling and the treatment, they get over that.
How do you feel about coming home? Feel okay? And you'll not be abusive to mommy again, the truth? You know why they had to take it in the first place to rob you? Why? You give trouble. Well, you're not supposed, okay, you're not supposed to give mommy any more trouble and you're not supposed to hit your mommy, okay?
Voices are saying that you are crazy.
Yes.
And is it very difficult to deal with that?
Yes.
But when you take the medication, is the voices still there telling you these negative things? And when you take your medication, you'll feel better, Some other time when you come, I will teach you how to cope with these voices that you're hearing.